One of the more sensitive topics that is discussed in the Women's Health Department are sexually transmitted infections, STDs, STIs. This includes gonorrhea, chlamydia, HIV, hepatitis B, hepatitis C, syphilis, among the more common tests that we perform at the Women's Health Center. It's really important that our patients feel open, that they can discuss this, and we try to create an environment where this is a comfortable topic to discuss. So one of the more common questions about STI screening is, who's appropriate for STI screening? Every woman is an appropriate person for STI screening who's been sexually active or is currently sexually active. A lot of STIs or sexually transmitted infections are asymptomatic. Women don't know that they have those infections, and the sooner we can make the diagnosis and treat that diagnosis, the sooner any ramifications or things that can happen down the road from having those infections, such as spreading disease or infection causing any issues with future fertility, can be addressed. One of the more common concerns or questions that I hear from patients more recently with the changes in how we do our cervical cancer screening is, I have HPV, and what does that mean? The human papillomavirus for women after age 30, we're now routinely testing for this very common sexually transmitted infection. 80 to 90% of women are exposed to HPV or the human papillomavirus in their lifetime if they are sexually active. We know that HPV is actually one of the more common causes of precancerous or cancerous cells of the cervix. So now all women after age 30 as part of their cervical cancer screening are recommended to not only have the routine pap smear, which looks at the cells at time of pap smear, but also HPV testing. This allows us to customize every woman's cervical cancer screening to make sure that we're not missing any woman who's at increased risk for cervical cancer, but also not over-testing and causing undue concern regarding their cervical cancer